So, how do you treat a bunion is a question that is often asked, and there are several options, but basically they fall into two categories, either surgery or non-surgery. And as far as ways that we can manage a symptomatic bunion without surgery, basically we're trying to find a way to take pressure off of the prominence that shows up on the inside part of the big toe. And so I always recommend patients use what we call an accommodative shoe, which is a shoe that has lots of space in the forefoot. And that, for a lot of people, is all that really needs to be done. As long as they can wear that shoe, that takes the pressure off of it. There are several splints and pads and things like that that can also be used, and toe spacers are something that we frequently recommend as well for bunions. If the bunion is due to arthritis, then sometimes we need to talk about a course of an anti-inflammatory medication or maybe even a steroid injection, and that can be something that helps for quite a while. If those measures fail, then we have a whole host of different surgical treatments that we can use to manage the bunions, and sometimes those require removing or replacing the joint. Sometimes it's just a matter of removing some spurs from the inside part of the toe, or if there's a spur on the top of the toe, we can remove those, and that may be all that needs to be done. Sometimes it's a much more complex reconstruction of the foot that can actually require addressing some instability at the arch of the foot or some rotational deformity of the toe as well. And so those surgeries tend to include making cuts in the bone and screws or plates and that sort of a construct to hold things while the bone heals into the correct position. We'll talk some more about what to expect after surgery and what activities you can do in the next session.